Click on this main services.
Yeah. Get back. So I'm gonna get this and hide and that back up. Oop. Cool. All right.
Good afternoon. My name is Dr. Jimmy Thompson, and I'm the Vice Chair of the OAA Grant Committee. I would like to call this meeting to order. The following Grants Committee members are in attendance: Tim Spencer, Sharon Buckman, Mike Tillum, Jim Holland has joined us remotely, and myself. We have a quorum. I'd like to begin the meeting by thanking the Prince Edward Volunteer Rescue Squad for hosting this meeting. And I would like to welcome all who have joined us either in person or virtually for this meeting. The first item of business today is the committee to consider a motion to approve the June 9th minutes as they were posted on the website. Do I hear a motion? Motion, can I have a second? Second for Mike Tillum. All in favor?
Aye.
Aye. Next item for the committee is for the committee to receive an update from our executive director, Mr. McDowell.
Thank you, Dr. Thompson. Well, good afternoon, everyone that's in the room or joining us online. My name is Tony McDowell. I thought it might be helpful for everyone to get just a quick snapshot of how we got to this point. And my colleague may have to advance the slides for me.
Right now.
Okay. So a quick history of how we got to this point with regard to the grant cycle for state agencies. The authority posted a request for proposals for state agencies on April 21st and noted that proposals would be due June 21st. During the time that agencies were working on their proposals, we hosted 2 question and answer sessions for potential applicants to join us and to ask questions about the process, and partnered with the Virginia Institute for Government in the process. Those meetings were held on May 2nd and June 6th. Ultimately, after the closing of that application period, we received 16 proposals from 16 different state agencies that included both executive branch agencies, judicial agencies, as well as independent universities, authorities, and so forth. So a total of 16 proposals that included 32 projects and came to a total of $22.7 million in requests. Our staff reviewed all of those proposals and began scheduling meetings and phone calls and interviews with the various agencies that had submitted the proposals to identify options to scale the awards for the proposals so that we could get closer to our budget. So again, we received almost 23 million in requests, and we had a budget of 8.3. So we wound up dividing the proposals into 2 different slates or 2 different blocks for the committee's consideration. One block of projects would be those projects that would receive one-time funding only, wouldn't come out of the normal state agency budget for the OAA, but instead would come out of the board's unrestricted funds. And then the second slate or block of projects would be funded out of the $8.3 million state agency budget. So as we're talking about budget, it might just be helpful for members of the committee as well as individuals that are watching online to understand how the OAA funds are divided. And so on the right side of this pie chart, you see funding that goes to cities and counties. And so 15% of our fund goes to individual cities and counties. And then 35% of the fund goes to cooperative partnerships of cities and counties. And this committee and the OAA board have already awarded the first round of grants in those categories. Today, we're looking at the next slice of the pie, which is state agencies, 15%, and potentially some use of unrestricted budget of 35%. And so what does that look like? Under the state agency budget for this cycle, our budget is $8.3 million. Today, we are proposing awards that come to a total of $8,157,170. That actually leaves a positive balance within the state agency budget of just under $180,000. We are also proposing $2.8 million in potential awards. These are for one-time projects for initiatives that are critical initiatives that were proposed for budget, that were proposed for funding in the state's amended 2024 budget, but that budget has not passed. We have no way of knowing when an amended budget might be passed, and so staff is recommending that the OAA move forward with a one-time award of $2.8 million for those particular projects as a one-time expense out of the OAA's unrestricted funds. And we'll explain a little bit more about specifically which projects we're talking about and where that $2.8 million comes from. Mr. Chair, I'd like to note that Senator Pillion has joined us virtually, and so it's for the minutes to reflect that he's now in attendance as well. Welcome, Senator Pillion.
Thank you, Tony.
So before I turn things over to Charlie to talk about the individual projects, I wanted to just share with the members of the committee. We have come up with a draft schedule for grant committee meetings for the rest of this year. And for 2024, these are listed in the handouts that you have in green. The timing of these meetings is based on the need to review applications that come in for cities and counties and for state agencies, so that the OAA can respond to those grant requests, funding proposals in a timely manner and be able to provide responses, get money out the door. You already know that we have a meeting on the calendar for December 4th. You can see the dates that are proposed for 2024. So I would just ask that as you go back to your offices next week, take a look at these dates and see if there's any conflicts and let us know. Otherwise, we'll start to firm these up as far as locations. We're limited under code as to how many meetings can be virtual versus in person. And so we're proposing for 2024 a virtual meeting in December and meetings in February, May, and August that would be in person. Yeah,
Excellent.
that's the end of my report.
Thanks,
Chair, Vice Chair, if there's any questions on that.
That's perfect timing. Are there any questions among the board members, the subcommittee members? If not, this is the time on the agenda where members of the public can address comments to the committee. Tony, Mr. McDowell, do we have any individuals signed up to speak?
Mr. Vice Chair, there's no one signed up to speak. I don't see any hands raised in the room. Maybe Kara can tell us there's no, if there's anyone online who would like to speak, maybe just click the button to raise your hand.
Well, the next item is for the committee to receive an update from the Director of Operations, Mr. Flynn.
All right. Thank you, Mr. Vice Chair. All right, so.
Hi.
Sorry,
Tony-
I'm just trying to
Oh, no,
excuse,
that's okay.
excuse me, just trying to find a place. Proposal.
Good. All right. Thank you. All right. So Tony gave you an update of how we kind of came to where we are. So now I'm going to talk through the proposals that we and the summaries for those and the recommendations we have around them. So the first thing I want to address is we have created kind of a blanket set of terms and conditions for these state agency awards that are in addition to kind of what we kind of created as our general template terms and conditions that we use for the city and county grants. So I modified that to work for state agencies. That was part of the RFP package that all the state agencies received. And so these are over and above that are more specific to these grants and operations. So this is going to include that, and all these will be incorporated into the agreement for the grant. So this is going to include terms and conditions that are outlined in the request for the proposal. So these kind of conditions that the agencies put upon themselves as part of the proposal, it will be included as well. Each recipient must adhere to existing practices, policies, directive, and applicable laws, including those for establishing new positions. So an agency may not use OAA funds to increase their maximum employment level over and above what the General Assembly may already been able to approve. If they have an approved position, they would have to use either a contractor or like an existing position that they have that's unfunded. OAA awards are for 1 year only. And they have a 1 year performance period, which is October 1st through September 30th of each year. Also, as I mentioned, we're going to do a formal execution of memorandums of agreements between the OAA and each agency that will form the basis of the award. And upon the completion of the MOU, the OAA will transfer the funds as soon as possible, either on or after October 1st. However, if the conditions in the MOU are not met, the OAA has the right to withhold funding until they are. Additionally, unless otherwise noted, each recipient may request up to 4 1-year renewals for their project. The OAA does reserve the right to require any recipient to submit a new proposal in lieu of the request. And after consultation meetings with all the agencies, they are aware that, you know, over time, the OAA's funding for this goes down kind of year over year based on the nature of the settlements. So also, in that vein, each recipient agency is responsible for planning for their own alternative future year funding sources for developing plans to either sustain projects when OAA funding is no longer available or to conclude those projects. Additionally, each proposal was required to submit performance measures, as we do for all of our grants. But many of these proposals, kind of through our evaluation meetings and trying to work to our recommendations, have been modified or changed. And so as part of that MOU negotiation, the OAA and the applicant will work together to kind of revise those performance measures to fit what the approved proposals are. Certain agencies are required by Executive Order 26, Directive 9, to participate in the FACT, which is the Framework for Addiction Analysis and Community Transformation database. And so that is for data that they collect that can be used for that. That's the state's database for trying to bring together all data around addiction and overdoses and that types of things to be able to layer them to help decision makers create, you know, policies and that type of thing. So any of the agencies that are not compelled are strongly encouraged by the OAA to work with FACT and transmit their data and is there as well. And lastly, recipients agree to submit to OAA for review any public-facing materials, such as online materials, videos, print materials, advertisements, prior to finalizing the release. So the OAA may elect to require its name, logo, and maybe certain wording, such as, you know, funded in part or in whole by the Opioid Abatement Authority or the Opioid Abatement Fund, so that we're publicly communicating that. Any questions on the conditions? All right. So we'll get into our proposals here. So our first proposal is from the Virginia Indigent Defense Commission. And for those not familiar, this is an independent state agency that oversees the public defender's offices throughout the Commonwealth. And so they proposed creating these reentry and recovery specialist positions in 7 of the localities with public defenders that have the highest overdose death rates combined with their largest kind of caseloads. That's Chesterfield, Fredericksburg, Lynchburg, Martinsville, Pulaski, Roanoke, and Winchester. And we were able to, instead of having them create new state positions, we were able to pair them up with Recovery Corps, which is subsidy of AmeriCorps that works with people that are in recovery to help get them into employment supports. And so these two entities are going to work together. And the Recovery Corps members are going to be, which are trained as peer specialists, or they are working on their peer certification, and they will help the clients of the Public Defender's Office navigate justice-involved situations and help them with resource development and recovery. It's things like case management, connections to care, things like that. So the program will also include 1 position at the Indigent Defense Commission for program oversight, and we are working with them. This is as a pilot program that could lead to expansion in future years. The OAA will require a report by both entities kind of measuring the results and addressing options for long-term strategies, including sustainable funding. Additionally, the Indigent Defense Commission is expected to work with other agencies, such as like local pretrial offices or Commonwealth attorney offices that may be looking to find out information about this project to possibly implement it in their own localities.
And Charlie, can I just add something here? I think this is one I really wanted to point out a couple things. One is great work by Charlie, because the original application was for the OAA to fully fund these salaries. Charlie connected the Virginia Indigent Defense Commission, kind of a tongue twister, with Recovery Corps. Recovery Corps has federal money to pay salaries for these folks. So it's really a win-win. Recovery Corps is helping individuals that are in recovery, helping them get their certification and placing them within public defender's offices. I think is really a win-win. And the only cost to the OAA is the parts that the Recovery Corps can't cover. So it's a lot more bang for the buck. It's also worth noting that not every community in Virginia has a public defender's office, and that's the reason why we wanted to make sure that VDIC would be willing to work with other institutions to help them provide the same type of support to communities and public defenders. And then the third piece is that I got an email from Delegate Ballard's office, and he asked for me to convey to the committee his particular support for this project. So Delegate Ballard is a fan. He's, for those watching online, he's a member of the board. He's not a member of the committee, but he asked that his support for this be included in the presentation. And
both agencies very excited to work together. It was one of the best. I had it on a Monday morning at like 9:30. It's a great way to kick off the week. It was kind of like a marriage made to be. All right. So next we have Radford University. So Radford is looking for funds, 160,000. Sorry, I forgot to mention the award for the Indigent Defense Commission would be $224,745. Radford University seeking an award of $160,277 to expand their existing Radford Collegiate Recovery Program, which also grew out with some support from VCU's Rams and Recovery Program. They want to enhance their outreach and awareness, overdose prevention, healthcare screenings and connections, and implementing a warm handoff process, and some support for a new living learning facility that they're about to open for people, students in recovery. They have also, in between us, their submission coming through and the awards that the OAA made back in June, they're going to work with that Montgomery County Award for the New River Valley ecosystem. They're kind of on the steering committee now, and they're, So two of our grants potentially are going to be collaborating together of their own accord without any OAA coercing. So it's a really great thing. Initially, some of their overdose prevention is going to include naloxone boxes on campus, working on prevention programs and getting those embedded in the Greek organizations. And they're also going to be offering scholarships to students that are in recovery. Next, we have the University of Virginia, who is working on for $258,171, what they're calling their SMART clinic, which is a street medicine access reduction and treatment. That's what SMART stands for. So it's a street medicine clinic that is going to be connected to a multi-day resource shelter known as the Haven. It's in Charlottesville area. So it's going to be an office, an OBOT, an office-based opioid treatment program, but it's going to be in the community. It's not going to be in one of UVA's facilities. And the idea is to engage individuals with opioid use disorder who otherwise do not seek treatment. It's also going to help provide access to long-acting injectable medications for people with opioid use disorder. It's going to expand their existing helpline and deploy harm reduction supplies via a vending machine. And anything that's included in that will have to be compliant with the FDA and Virginia Department of Health guidelines. The OAA is working on potentially engaging with a third-party expert to be able to kind of look at the effectiveness of the program from a clinical standpoint. So next we have the Department of Medical Assistance Services, which is the state's Medicaid office. So they are looking for, in the first year, $150,000 for a multi-step project. The first year includes the $150,000 for DMAS to create and facilitate a program for hospitals to launch emergency room bridge programs for patients with opioid use disorder. The emergency department bridge clinic model seeks to address significant gaps in the continuum of care for individuals who present to the emergency departments with overdose emergencies. For people with substance use disorder, the emergency department is one of the few linkages to the healthcare system that can help them address their needs. And these emergency department bridge programs consider the emergency department visit related to an overdose emergency as like critical intervention point to offer supports and services, not only while they're in the hospital, but for follow-up linkages to care once they're back outside. So the process will set up an RFP to gauge interest from the hospitals. And then in the second year, the award would be approximately $950,000 to launch at least 2 bridge programs each year. And once the programs are launched and in place, they are usually able to be supported, self-sustaining ththrough medical reimbursements. And DMAS has successfully managed a couple of these programs, one at the Carilion Clinic in Roanoke and one at VCU Health System in Richmond through a federal grant that has ended. So, and DMAS and OAA will work together on the development of the RFP, and we will be able to see the results of the RFP within about 6 months, so that can help us plan for potential future funding needs based on the interest. Next, it's Virginia Commonwealth University, and they provided 2 proposals that are recommended. So for a total of $525,711. So the first one is for VCU's Wright Center for Clinical and Translational Research to create a technical resource toolkit for Virginia cities and counties. This will have VCU researchers working with the Virginia Society of Addiction Medicine for an online toolkit that provides examples of opioid abatement best practices and evidence-based programs that cities and counties can implement using their opioid settlement funds. VCU will also offer technical assistance, including strategic planning, program implementation, evaluation services on a fee basis. And the localities can use their opioid abatement funds to work with VCU on that. And they will be able to publish information from the toolkit online on a quarterly basis. The second proposal from VCU is from VCU's Massey Cancer Center, which does serve a very wide and diverse clientele that are in cancer treatment. And the idea is to research and develop protocols for pain management in palliative care settings. There's increasing issues with patients surviving their cancer, but have a heavy opioid dependence to manage the pain that goes along with this. So the idea is that protocols will help healthcare providers be able to look for the signs of opioid use disorder, and then also for people that to be able to step down either to lower level opioids like buprenorphine or naloxone, or to be able to wean them off altogether. So the project is recommended. That's a $245,000, and the OAA again may use a third-party expert to help review the effectiveness of this program.
Charlie, if I may, Mr. Vice Chair, we do have with us this afternoon, Dr. Jerry Muller from VCU. He's made the drive down from Richmond, and I think was the primary author of this proposal. So I'd like to thank him for being here. And as Mr. Vice Chair, if it's appropriate, Mr. Muller, Dr. Muller might want to make some comments. That would be great.
So we're very excited about rights center in terms of clinical translation research and community engagement is a major part of the rights center. One of the things we're going to really look forward to is engaging public communities across Virginia to set up. So it really becomes a collaboration with the communities to see what their resources, their needs are, and matching to this with evidence-based programs for prevention. And Massey Cancer Centers, it favors me this because they're doing a very good job of treating patients who in the past would have died of terminal. And historically, what they would do if somebody, is palliative care, they just give as many opioids as possible, but those patients are stuck on these giant things. So that's that.
Thank you. All right, next. So I have these next 3 agency proposals all on the same slide because they all center around youth prevention programs. And so I want to note up at the top that all three of these organizations have agreed to work with an OAA-led kind of coordination meeting on youth prevention programs. So we can see how the progress is made. We can see opportunities for streamlining things, and also make sure there's not any duplication of services. When we received the proposals from these organizations, there was some overlap in their initial proposals. And so we worked with them, primarily Cindy did, to kind of figure out what piece do they do best that we want to see. And that's how we kind of put these things out. So the first one from the Department of Education for $520,250. We'll use the funds to hire a health and safety plan coordinator to work with school districts across the state to implement K-12 opioid abatement programs. And they will also create an opioid abatement education ambassador program for student-centered social media campaigns. The next one from the Virginia Foundation for Healthy Youth for $1.2 million. And this is one of our items that is recommended for one-time funding from the OAA's discretionary budget. We'll have them launch a prevention and education campaign for youth and young adults with message packages that will be reaching approximately 1 million youth ages 13 to 24 with a frequency of 2 to 6 times each. The campaign is going to include initial concept development and testing, which has both quantitative and qualitative testing to determine the most effective messages in the vehicles for that, and branding elements for the audience. Additionally, it's going to have 2 unique message packets lasting approximately 8 weeks each, and one which will be like a flagship video commercial. And the third one is through the Virginia Cooperative Extension that is as applied through Virginia Tech. And so they're going to use the funds to continue this rural opioid technical assistance program that was initially stood up under a federal grant that expires at the end of this month. And that's going to include 4 full-time regional coordinators, a project coordinator, and some part-time regional agents. And among other things, the program trains teachers to implement evidence-based, the Botman life skills and the mental health first aid programs in schools, and enables extension services to participate in regional coalitions where they provide support focused on substance misuse and addiction. It also will help them for disseminating evidence-based preventions to individuals and their families, and facilitating and coordinating access to extension and Virginia Tech services and expertise. And that's for $724,856.
Member Committee, this is almost a $2.5 million set of investments in youth and young adult prevention out of the 11 million total this year. So that's a strong investment in prevention.
So next, we have 3 proposals from the Department of Behavioral Health and Developmental Services totaling $522,289. So the first proposal is to fund a substance use data analyst to collect and aggregate agency-wide data related to substance use efforts by DBHDS and the various community service boards and behavioral health authorities across Virginia. The analyst will be responsible for coordinating the agency's participation in Virginia's data warehouse known as the Framework for Addiction Analysis and Community Transformation that I mentioned earlier. The second project is for the agency to work in coordination with the training committee for the Office of the Executive Secretary of the Supreme Court to develop a training curriculum and plan to offer training to judges, Commonwealth attorneys, defense attorneys, magistrates, probation officers, and other professionals who work in the court system on the topic of substance use disorder. The training is going to focus on examples of successful alternatives to incarceration for individuals who respond well to treatment and recovery services. And DBHDS has agreed to involve various criminal justice stakeholders in the process, including Commonwealth attorneys and members of the Bar Association. The funding for the first year will be used to develop the curriculum and delivery plan, which could then be implemented in the subsequent years. And the third project for DBHDS is to develop for $200,000 to develop a plan for Virginia's second recovery high school. One currently is in Chesterfield County, serves youth with substance use disorders in Central Virginia. The scope will include researching geographic trends related to adolescent substance abuse, as well as identifying regions within school districts and local elected bodies that are interested in partnerships to open a recovery high school, and also identifying the clinical supports and financial and operational requirements to set up the school. Next proposal is from the Office of the Attorney General. And this, just a note, they only asked for 1 year of funding. They did not ask for funding in the out years for this. So the project will launch a mass media campaign to educate Virginians about the dangers of opioids with the focus on fentanyl, built on the One Pill Can Kill and Get Smart About Drugs public information campaigns from the U.S. Drug Enforcement Agency. The OAG will purchase advertising on billboards, radio and television stations, and digital and social media platforms. This will raise awareness and drive teens and their parents and caregivers to drug awareness resources at the Virginia Rules website and DEA's website, Get Smart About Drugs. The public service announcements will run for 6 months, reaching over 4.5 million Virginians between November 2023 and May of 2024. Additionally, the OAG has contributed $60,000 in matching funds, and partnering media outlets have contributed $450,000 worth of advertising in kind. And I mentioned the OAG did not request out year's funding for this. The next request is from the Office of the Executive Secretary of the Supreme Court of Virginia. They will use these funds to develop a statewide best practices standard for drug testing within all alternative dockets, and promote awareness about that standard to all localities that provide financial support to alternatives. The OAS also use the funds to establish a grant program to offer financial assistance to localities to help pay for special docket drug testing that meets the OAS standards. They will work with the OAA on the kind of the RFP process for that, and will be able to be involved in and see how the decisions are made. Next, we have the Department of Health Professions. In recent years, the Department of Health Professions has received funding to connect the prescription monitoring program to prescribers' electronic health records and pharmacists' pharmacy dispensing systems. The effort has been very successful in promoting appropriate use of controlled substance. However, federal funding from $830,000 has been reduced to about $468,000, which has resulted in a gap of $361,000 that is needed to maintain the functionality of this program. And that is the amount that they are asking for, $361,219, just to fill the gap. The next is from the Department of Criminal Justice Services for $710,000. And this project will provide funding for the Commonwealth's Addiction Data Warehouse, that I'm now for the third time mentioning, for the FACT, or the Framework for Addiction Analysis and Community Transformation. Support for FACT is necessary to input and integrate data from state agencies as required in the Governor's Executive Order 26, the Crushing the Fentanyl Epidemic, to support the implementation of the Right Help Right Now Behavioral Health Initiative, as well as supporting public entities that submit and analyze data for mapping and reporting. The funding also includes a full-time employee in a DCJS that will be dedicated to the project management of FACT. It's currently managed by someone who has another full-time job in addition to her other full-time job of managing this project. So there is a lot of effort and data statewide with a lot of federal dollars that have been put into the development of this database, and this is going to kind of help keep it going forward. So now we're on to the Virginia Department of Health, who had 4 proposals for consideration, totaling $2.9 million, $2,903,843. So the first is another one of the one-time fundings from the OAA's discretionary budget, and this is for staff and for direct operating expense to expand the state's distribution system for intranasal naloxone. VDH will onboard contractors and grant limited staff to expand the number of high-impact organizations eligible to receive free or reduced cost naloxone, and the agency will create a mail order system for people who are at risk of overdose to order naloxone for postal delivery. These enhancements to current strategies will be based on nationally accepted best practices and fully compliant with FDA and VDH regulations. The second is the last item that is for one-time funding from the OAA's discretionary budget. $1 million is proposed for VDH to purchase doses of intranasal naloxone for distribution. The amount does not fully fund the agency's need, but will assist in covering shortfalls due to the expiration of federal grants. Third proposal is $1 million. It's to support the agency's goal of supporting and extending certified harm reduction program sites around the Commonwealth. Funds will be used to add 1 outreach worker to each of 7 existing program sites in cooperation with the nonprofit organizations that lead those. And additionally, a position will be funded in each of 3 new harm reduction sites to be identified by the agency. These harm reduction workers will be charged with identifying people at high risk of overdose and providing them with education, treatment, and connections to care, including access to primary care and naloxone. And all harm reduction efforts will be in full compliance with FDA guidelines, state law, and VDH regulations. And the last one for the Virginia Department of Health is $300,000 for the salaries for 3 new opioid use specialists. One will be embedded in each of 3 different local health districts, which would be the 1, the Hampton and Peninsula Health District, 2, the Portsmouth Health District, and 3, the Richmond and Henrico Health District. The OUD specialist will champion the district-wide efforts of collaboration with local governments to maximize the reach and effectiveness of the agency's various opioid use disorder abatement and prevention efforts, so prevention, education, treatment, and recovery. We're almost there. Virginia Department of Social Services. So this project provides DSS with funding to expand their Kinship Navigator program in coordination with local governments and community partners. Parental substance abuse is one of the reasons for removing children from the home, and in many cases, extended family members that would be known as kin, or friends, which are known as fictive kin, assume the guardianship of these children. Kinship navigators provide support to kin or fictive who are acting as guardians or care providers for the children. The project provides DSS money to fund competitive proposals submitted by local DSS offices seeking to expand their currently existing kinship navigator programs. The local governments which operate the local departments of social services are also able to use their direct opioid settlements or their OAA individual distribution grant funds for these purposes. So this award will fund the expansion of up to 5 different kinship care navigator programs beginning in 2024. The total cost for this is $205,500, which is about a half a year funding, because we don't expect costs to incur until early 2024 due to the RFP process and onboarding of staff. So this is the last one. Virginia Department of Corrections has 3 proposals for a totaling $1,254,152. So the first proposal is to fund 6 contracted licensed clinical social workers to support opioid use disorder therapies at 6 DOC institutions that operate medication-assisted treatment programs. The addition of licensed clinical social workers is expected to significantly increase the therapeutic components of the programs and to contribute to improved patient outcomes, improved success in reentry to the community, decreased overdoses, and reduced rates of recidivism. The second proposal is a one-time funding, still out of the state grant budget, but in the amount of $648,000 for a pilot program to evaluate the effectiveness of long-acting injectable opioid agonists for inmates that are diagnosed with substance use disorders. Up to 30 state-responsible inmates transferred to DOC by local or regional jails with an existing prescription for OUD medications will be enrolled in the pilot program. These patients will be switched from receiving a daily oral dosage of an opioid partial agonist, such as Suboxone, to an injectable buprenorphine extended release medication, such as Sublocade. The method of medication administration, this injectable administration process has been shown in other settings to reduce diversion and misuse while improving patient outcomes. Pilot project will be overseen by DOC's medical director, will study system-wide changes in overdoses, emergency room visits, and hospitalizations of patients under DOC's care, and it will create a report to provide to DOC leadership with documented findings and recommendations. And the last item is $20,000 for a creation of a video that provides substance use disorder education to all inmates at their reception into the Department of Corrections. Video is going to focus on addiction as a chronic yet treatable illness and will highlight program options that are available to inmates within the DOC. Additionally, the video will be shown on DOC's Wellness Channel and District Probation and Parole offices. The intent is to provide all inmates with an option to view the video at least once during their incarceration. So, any questions on any of the other state proposals?
I have a question,
Mhm.
and just for the exercise of asking a question, but a real one. Curious about which proposal is this? On page 21, state agency proposal. Department of Health, Virginia Department of Health. Proposal number 3 talks about funding for outreach for the certified harm reduction program site.
Mhm.
And it mentions later 7 existing program sites. What are those sites? They identified in the,
They are, I don't know that I have those in front of me, there's. Off the top of my head, the one in Northern Virginia is run by. Workshop.
Oh, Chris Atwood Foundation.
There's the. I'm sorry, I listed out. But it does, is reduction. There's a total of 7 states that have been certified by VDH to run these sites. And so these funds would be provided to those nonprofits to add outreach workers. And the outreach workers, their job literally is to find people. So they're gonna engage people that housing insecure, homeless, they're gonna be connecting to people that are coming out of emergency rooms, jail, and meeting them where they are, so to speak, and offering them services. We'll absolutely get that list for you. I just don't have it in front of me.
just trying to remember, it seems like there was another proposal that involved creating harm reduction site.
Part of what DDH is doing is they have a goal of building out additional harm reduction sites state. I think that there's 11 right now in the Commonwealth, and they want to get to something 28,
Okay.
but they can't do it all at once. This incremental step in the direction. And so even with this funding, it doesn't provide everything that they need, but rather gets us one step down that.
As part of the process for the site to become certified.
That's
Yeah, the UVA proposal would have a harm reduction machine,
That,
which would be really that's like things like you can get in the lock zone, you can get trying to think of what all goes into this. Not, I don't think needle exchange is allowed. Not sure about that either. I know there's things like condoms and all kinds of various, more than just, there's opioid use harm reduction, things like naloxone, but there's a broader kind of category of harm reduction. That was the other kind of main mention of harm reduction. I think in the other person. That's not like a site with connections to care. That's more of an access to
right,
various materials and that kind of thing. So
they don't, it's not talking about that.
no, they're separate.
Existing
Mhm.
recertified.
Yep.
This is what I should, I'll try to list these off to you. Chris Outwood Foundation.
Yeah.
It's the Health Brigade in Central Virginia. Strength in Peers located in Buckingham. There's Strength in Peers has. Navigating here on as we speak. Minority Aid Support Services, Hampton Roads area. Roanoke, we have Virginia Harm Reduction Coalition. And, I'm missing one. That's another strength of years, but just to be abundantly clear for members of anyone that's attending online, Virginia doesn't allow yet needle exchange, and so the harm reduction efforts would be only to the level of what's been what the General Assembly has approved in existing code. And again, the responsibility to certify that rests with VDH. And so in any of the programs that we've recommended for funding that involve harm reduction, we've made a note that they would have to be in compliance with state code and their VDH regulations.
Is there anybody else with a question? For Charlie?
I've got more stuff.
Great, yeah, next item is for the committee to receive an update, another
Yes.
from Charlie, more.
So now switching gears, this is updates to our city grants processes. And so this is for the process that will launch again October 1st and run through April 1st. That will be not only new applications, but amended applications or renewals of applications for awards that you've already been approved. So this is basically just kind of the items that we have kind of identified. We did a big brainstorm, kind of lessons learned based on our own experience, as well as feedback we received from numerous applicants about how we can kind of improve the process on both sides. So we want to provide a standardized sheet to collect information regarding the use of the direct distributions, including any of the funds that reserved by the local governments for future use. We're going to remove the requirement that the elected body must adopt a resolution in order to apply for the gold standard or any resolution requirements. They seemed like a great idea, and we thought it was clear. And when we started explaining it to people in various situations, it was more confusing than we had ever intended. So this will allow the chief executive or a person with signatory authority to sign the agreement. Some localities may need to execute resolutions to do these things, and that is fine. It just would not be no longer be a requirement of the application process. We'll provide standardized budget spreadsheets for both revenues and expenditures for each grant. Cooperative partnership applications will have to list the sources of contributed funds coming from each partner in those budgets, as well as any cash contributions that are offered on behalf of applicants from other organizations. Also, for cooperative partnership applications, we'll revise the sample agreement so it also references and it is in line with the budget spreadsheet. We had some times where I think they were done by different people and they weren't connected. So also for each grant, regardless of type, applicants will have to submit a narrative addressing sustainability. We're also going to request more clarity about subrecipients and contractors, and that will primarily be just through a more prescriptive form change instead of a narrative box that we had in the previous cycle. We're also going to publish a number of our kind of the outstanding applications, some of the best in class from the first cycle on our website to serve as examples for others to follow. And we're hoping to have that done in end of this month, early September. We're also going to see if we can identify some localities that have been successful in the process and both applications and executing grants that might be willing to serve as help to those that are new to the process. We're also going to offer kind of a period of time where applicants can submit drafts to review for feedback prior to the actual submission deadline. Additionally, as you saw, we have there are a few grant meetings that are open during the process. And so some, especially around the individual distribution awards, we may be making like awards during the cycle for those. The cooperative partnerships will again have to wait until the end of the process because of their competitive nature. So when we put the guidelines out, we'll have a kind of a soft deadline to review a draft. We'll have a deadline that if you want it considered by the next grants committee meeting, it needs to get to us for consideration and that kind of thing. So it'll be a lot easier for people to follow, and we don't have to wait till the end if people want to do stuff earlier. We're also going to have more clarity provided on the different types of funds that cities and counties have and can use. Tony's actually already working with me on a draft of the sheet for each city and county that tells them how much they have, and we're going to kind of expand that out. Hopefully we'll be more settlement dollars to communicate by October 1st and make it a little clearer as to what they are and then how you access those funds and how you can use them. We're also considering going to try to put some flow charts in for some of the more complex situations where you're, especially in the cooperative projects where multiple funding types are being used together. We're also going to make sure that it's explicit that cooperative partnership grants are only awarded 1 year at a time, and reiterate the expectations that are needed in order to receive a renewal in the subsequent year. And then also we'll have an application process for new projects, and then we'll also have processes to kind of renew a current process or amend a prior award. We're hoping the renewals and amendments can kind of be in one form. The information will be very similar. So the bulk of the information that we collected and that the grants committee approved back in January of this year will still be there, just be laid out in a little cleaner and more streamlined way.
This is really just us looking at what went well, what we can improve upon, continuous improvement, and asking the committee to give us the flexibility to make these revisions to the application process for.
So any questions on that part? No. All right. So my last item, we have I was going through the award process and working with cities and counties for the award package we were putting together. We found a couple of items that needed some technical amendments to those that were approved by the committee on January 9th and the board on June 9th, and the board on June 23rd. So there are 3 awards. So the first one is for Accomack County's individual distribution. It was kind of a misunderstanding when we put the award together and kind of over credited their direct funds that they currently have and under awarded the individual funds. So there'll be a business item in a few minutes to kind of adopt an amendment to this. That will right size that. It'll increase their award by about $14,000 from the individual pot from the OAA and reduce their direct contribution that they can hold for other projects at a later time. The next one is the Montgomery County Cooperative Partnership. This is the New River Valley Recovery Ecosystem. There was again some most of these basically all 3 of these are around kind of miscommunication, misunderstanding about money that was supposed to come out of the direct versus what was supposed to come out of the individual distribution. And so we need to have some corrections there that will kind of change the reduce the OAA's individual distribution amount that was awarded. And the same thing with Stafford. There's some money that should have been credited to their direct that was credited to their individual distribution. And so for those 2, what we'll be asking is for the flexibility for the executive director to negotiate with them to be able to right size those awards, as so long as the total cost of the project remains the same, the commitments for the matches remain the same, and there's no kind of change in the scope of the process. Happy to take any questions on.
Mr. Vice Chair, we do have one question that's been submitted in the chat.
Okay.
And with the committee's indulgence, I'll read the question.
All right.
We can see if we have an answer for this person. So the question is, thank you to the panel for this informative presentation. I'd like to know, does the Virginia Department of Health have real-time overdose tracking systems in any municipalities? If not, are there any plans to integrate such a system? I think I can provide, I'm not a representative of EDH, but I pay attention to what's going on, so probably provide at least a partial answer. This is not an official answer on behalf of EDH, but I do know that within the Virginia Department of Health, there are mechanisms for collecting overdose data. Some are more real-time than others. So, for example, they collect information from autopsies, but that obviously is not in real time. They also collect information from the Virginia Office of Emergency Medical Services, which is probably the closest thing to real-time overdose data that VDH and localities have access to. Part of what the governor's executive order is doing is requiring these types of data to be submitted to FACT, the Framework for Addiction Analysis and Community Transformation, so that this type of data can be shared with local governments in a more time responsive. And so there may be other things that VDH has in motion, but that's the best answer. Anyone else in the room, members of the committee, have any thoughts on?
I know that data is published, but usually on a monthly basis, real time, that's.
The real-time data that I'm aware of is only shared with law enforcement, EMS, public entities, because there's privacy concerns. If EMS reports an overdose in a very rural area, it would be relatively easy for someone, if this was available to the general public, it'd be relatively easy for a person to figure out who it is. So that would not respect the hidden. And so there are limits to who can be in data. Carol, were there any other questions? I think we're ready. Question was, how do service providers best reach out to localities? Well, I think that what this committee is doing is creating a lot of buzz in the community, because you have now cities and counties that have the ability financially to hire contractors or to spend funds within their own agencies to provide services to people in a way that they weren't able to before. And so that buzz is creating interest both in the service provider community, in the nonprofit community, and obviously among the publicly funded treatment services. And so localities will sometimes issue requests for proposals. They have the procurement process they go through. So any service providers that are listening in will be encouraged contact the people in your local governments and in your communities to make sure that services are being offered, and pay attention to what's out there on the procurement websites. We had a large county in Northern Virginia that posted a request for proposals for a multi-million-dollar program and didn't get any responses from the community. So, we'll do our part. We work with like the Virginia Association of Community-Based Providers, with ASAM, with a number of organizations to push the information out. But at the end of the day, service providers need to be knocking doors and building relationships.
If you have a specific situation you'd like to discuss with us, you can send an email to the info@boaa.us, and one of us would be happy to kind of work with that.
And now we're moving to our new business. The component of this meeting, and the grants committee will take up new business issues, including the consideration of state agency applications. Chair will consider OAA staff's recommendations in separate blocks of motions. The first two blocks will be those applications whereby no member has voiced a possible conflict. The third block will be one application whereby a single member, myself, has voiced a possible conflict, and I will therefore recuse myself from chairing, deliberating, and voting when that time comes. First, we will turn to the first block of applications whereby no member has voiced a possible conflict. The committee will take up for consideration the state agency applications listed in a block and provided on attachment A of this agenda. That if passed will be funded from the portion of the opioid abatement fund restricted to use by state agencies pursuant to Virginia Code. As it says, can't read that. So the chair will now entertain a motion to fund the 14 state applications just announced, consistent with staff recommendations. Should we go over that list briefly?
It's provided on attachment A. So
If everybody has attachment A, we can just. We have a motion, second, and a second from Phil. All those, start with any opposed vote? Or any discussion? Any discussion of the issue? Questions, any clarification needed? Okay. We've had, a motion from Tim Spencer and a second from Mike Tillum. All those in favor? Say aye.
Paula.
Thanks, Jim. Sounds like it's unanimous, and we run out of votes. No need for a veto. Thank you. That was great. Nice to be able to vote in the block. Okay, now turning to the second block of applications. Grants committee will take up for consideration the following state agency applications in attachment B, the block listed in attachment B of this agenda. And if passed, will be funded from the unrestricted portion of the opioid abatement fund pursuant to the listed code. Let's start off with any questions, any clarification needed on which motions, proposals we're talking about, any discussion? Good. Okay. Chair will now entertain a motion to fund the two state agency applications as just announced, consistent with staff recommendations. Do I hear a motion? So Spencer, second.
Second.
Thanks, Mike Tillum. All in favor? Aye.
Jim Paula.
Thanks, Jim. Finally, we will turn to the third and final block, whereby out of an abundance of caution, I'm recusing myself from chairing, deliberating, or voting as I may have a conflict of interest as a immediate past president. And being involved with this project. At this time, I will ask my colleague, fellow grants committee member, Mr. Timothy Spencer, to chair the final lot.
Thank you, Dr. Thompson. Grants Committee will now take up for consideration following state application that if passed will be funded from a portion of the base fund restricted to use by state agencies pursuant to the Virginia Code. One that we're considering is the VCU OAA Toolkit for Cities and Counties project and the Massey Cancer Center opioid use guidelines for cancer patients as presented earlier in this meeting. Is there a motion? There's a second?
Second.
Any discussion? All those in favor say aye.
Aye.
Opposed? Matter passes. Thank you. Mr. Chair, back to you.
Mr. Pfister. New business item D. Final item of new business this evening is to consider the recommended changes to the upcoming grant application process for cities and counties. Staff has presented a number of administrative changes that relate to forms, time frames, and other details. The chair will now entertain a motion to approve these administrative changes consistent with staff recommendations. Do I hear a motion?
So move, Jim Holland.
Okay, all right, that's made by Jim and seconded by Mr. Spencer. All those in favor, please say aye.
Aye. Jim.
Motion passes.
By saying it's fine,
Actually, yeah, final item number 2. The Grants Committee will now take up 2 technical amendments to previously approved grants, as just discussed by Mr. Linekum. Turning to the first technical amendment, the Grants Committee will take up for consideration the following motion: that the executive director is authorized to negotiate with both Stafford County, in its capacity as fiscal agent of the cooperative partnership that includes Caroline County, Fredericksburg, King George County, and Spotsylvania County, and Montgomery County, in its capacity as fiscal agent of the cooperative partnership that includes Giles County, Floyd County, Pulaski County, and Bradford, to amend the amounts pledged as match from their individual distributions and their direct distributions, so long as the total amount pledged does not change and no additional award amounts from the OAA are necessary. The chair will now entertain a motion as just announced, consistent with staff recommendations. Do I hear a motion? Motion made by Mike Tillum. Do I have a second?
Second.
Second by Timothy Spencer. Any discussion, any questions? All right, all those in favor, please indicate with an aye.
Aye.
Holland.
Sounds like it passed again. New business item F. Now, turn to the second technical amendment. The Grants Committee will now take up for consideration the following. Yeah, that the ACOMAC individual distribution award be amended to reflect an increase of its individual distribution by $14,872 and reduce direct distribution match by the same. The chair will now entertain a motion to amend, as just announced, to staff recommendations. Do I hear a motion?
Second.
Motion by Tim, second by Mike Tillum. All those in favor say aye.
Aye. Jim Holland.
Yes. Would any, I can come to the close, but would any members of the committee like to make any?
I would just like to express appreciation to the staff for once again going through all of these applications and rigorously and thinking in terms of making the best use of these funds and the recommendations that us are balanced across the continuum of interventions and
thank you.
That is definitely, it's taken a lot of work, job well done. As well as the proposed amendments to the process, also well thought out, appreciate that. I'd just like to say as the vice chair of the committee that it's exciting to be able to vote on issues that cover treatment, prevention, and recovery support services.
Research.
And research all together in one meeting. Very happy to be here. Anything else? Can I get a motion to adjourn?
So moved.
Motion, made, seconded by Mike. Do I have to take a vote? Can I just say? Meeting is adjourned.
Stop it. Stop recording. Well, thank you. You know, we had Cindy in the new one.